The video series Diabetes Educator was developed by the Georgia and Oklahoma Academies of Family Physicians as part of the Go Diabetes Initiative. The Diabetes Educator series consists of 6 video vignettes, each outlining best practices in the care of diabetic patients. Please proceed to the registration page for more information on the approved number of prescribed credits for this activity, as assigned by the American Academy of Family Physicians, and AMA-PRA Category 1 credit as assigned by the Georgia Academy of Family Physicians. Upon completion of each video vignette, please return to the Resources video page on the Go Diabetes website to complete the activity evaluation and earn your CME. This activity is supported in part by an educational grant from Sanofi Aventis. We thank you for participating in this online activity and hope that it serves as a valuable educational tool.
So what do we do regarding assessment of that patient in the topic of healthy eating? We find about food preferences, we find about portion size, knowledge of how food affects metabolic control. I work a lot with Latino patients, and my patients, Mexicans most in origin, have never heard that tortillas will raise their blood sugars. How come? It's not sweet. So just by making that connection, that very basic level of knowledge, you're gonna help those patients make a huge impact on making a big change. Who shops and prepares the meals? It's very important for us to know. Financial resources. You know, are we dealing with WIC? Are we dealing with people that can afford to eat out or are buying fast food, what the situation is? And religious and cultural preferences. Patient goals will be that they will follow a schedule. How many times our person is eating twice a day? Is that the way it should be? No. Patients need to be eating 4 to 5 hours. Every 4 to 5 hours. So eating twice a day is not good for her diabetes. They need to follow the meal plan that have been agreed upon. They need to decide what types of foods, if the issue is quality of foods, and issues around overeating. Intervention, we're gonna define an individualized meal plan. If you are using diet sheets in your office, please throw them away. Please. Take one home and try to follow it. Tell me how that goes. We used those probably 15 years ago, and they're still around. Diet sheets, 1,500 calorie, 1,200 calorie, 800 calorie, nicely printed, black and white. If you find some, do not use them. They're worthless. You have to talk to your patients specifically about their situation. I live in Georgia. As you probably already heard my accent, I'm not from Georgia. If you tell me, if you give me a diet sheet that says that I need to eat grits for breakfast, that's not going to go in my diet ever. If you tell me that I need to eat tortillas, that's not going to go in my diet because I'm not Mexican. I'm Colombian. So you need to talk to me specifically. Don't tell your patient to lose 30 pounds and come back in 3 months. It's not going to happen. So please talk to your patient. If you don't have the time, find or identify the person that can be trained to do it right. Patients can use food diaries, counting carbohydrates, and menus, different type of things. What are the outcomes? Weight loss, weight management, healthier food choices, and of course, blood glucose control. Look at how life has changed for us. In 1955, McDonald's fries were 2.3 ounces. They are 6.9 ounces. In 2001, God knows what they are now. They went from 200 calories to 610 calories. Your patient, still eating 1 portion of McDonald's fries. They don't care if it's this big or this big, they're still gonna eat it. And look at the difference. A Coca-Cola, 6.5 ounces to 20 ounces, and this is being generous. Do you have gas stations with 64-ounce Coca-Colas? Oh. 86 calories to 230 calories. And if you multiply this by 3, it's 600 calories on a Coke for breakfast. That's not counting the sandwich they got or the whatever else. A Snickers bar. How many Snickers bars here? I eat Snickers bar. 1.1 ounce to 3.7 ounces. You've seen the Snickers bars that there's 2 inside now? You open it, and that's one. You're gonna eat the whole thing. And Snickers are in now with Betty White, right? So gotta be careful with the size of those Snickers bars. 500 calories on a snack? Oh my goodness. So we know the problem that this has caused, and we need to work on it. Being active, how are we gonna get our patients to exercise? Don't just tell your patient, go home and exercise. Go home and exercise, okay? Is that gonna work? We all know we need to do it. How do you make it happen? You gotta find out what are the barriers. You're gonna find out, are they doing something? Do they need to increase? Remember, 5 days a week, 30 minutes. Have they started? What is our person doing? She's doing twice a week, 15 minutes. So she's doing something. Build up on that. Recognize, reward success, and build upon it. If they're not doing anything, you have work to do. What will they be doing? What time of the day will they do it? How are you going to maintain it? How are they going to afford it? You got to find the specific exercise that that patient is going to do. Do you have the time to do that? Maybe not. Find the person that can take the time to work with your patient. Look at this. I always get a kick out of this one. Chewing gum. So maybe we'll get our patients to chew gum all day long. You will burn 11 calories. Walking, and walking faster, gardening. I have a lot of my patients are gardening now. They love it. Sexual intercourse, we can all encourage that. We can talk about both topics, ED and do we need to do more of it? Climbing stairs, running, and running. So somewhere in this chart, your patient is going to fall. So please make sure that make it fun and work with them. Monitoring. We already agreed that monitoring was more than blood glucose, but I don't have all the time to talk about it, so I'm just going to talk about blood glucose. It's a challenge. You need to be clear. You need clear directions. When do you want your patient to test? When do you ask your patients to test? I will have a heart attack if I hear in the mornings. What happens if you only test in the morning? You only know what happens in the morning. You know, right? And what good it is if your patient has been wasting strips, a drop of blood on blood sugars of 90 every morning. I'm fine, and the A1C is 11.4. You're not letting them see what happens. So you know the analogy I use? I tell patients, you won the lottery, you went to China, you came back, and you're going to tell me about your trip with one picture. Does that tell me what you did in China? It does not. You need to test. So I tell patients, there's 4 times of the day where you need to test. Fasting, pre-lunch, pre-dinner, 2 hours after biggest meal of the day, or some people have a bigger meal of the day at lunch, sometime at dinner. So we identify those times based on their A1C, based on their treatment. Are we adjusting? Are we maintaining? How much money do they have? I work with low socioeconomic people, no insurance. I'm very careful because they have to pay out of pocket for those strips. I go from twice a day to twice a week. If you have insured patients, you may do 3-4 times a day. But make sure that what you're asking your patient to do is worth their effort and their money and their blood. You gotta use it to adjust. You gotta make sure your patient knows why they're testing and what they can do with those results. If not, just have them test a little more frequently right before the appointment. You don't need 3 months of 4 times a day blood sugar if your patient is not doing anything with that information. If it's sitting in the meter memory, that's a nice revenue for the meter companies. Is it good for your treatment? Is it making a difference? No. So be very conscientious about how you're asking, very clear how you're asking. Be selective. If you have insured patients, find out what are the meters that your companies cover. If they're uninsured, make some selections that are good for your patient cost-wise.